excessive vomiting. So pregnancy entails a few very common symptoms, like back pain, vomiting, indigestion, or shoulder pain, or sometimes neck pain, random aches and pains. Along with this, increased frequency of urination, or aversion to a lot of smells in day-to-day life. But the most common or most irritating symptom of pregnancy has to be nausea in pregnancy, which is experienced by almost 90% of the females. In some variation, some people have it very less, some people have it a tad bit more, and then there are people who absolutely cannot digest any kind of solid food, at least for the first trimester of pregnancy or the first 3 months of pregnancy. So those kinds of people who are experiencing extreme nausea and vomiting, who are not able to digest any solid food, who absolutely cannot, by the smell of food, they are, forced to vomit, or they are vomiting greenish colored fluid. We call it bilious vomiting, which is mostly due to prolonged fasting states. And so all of these patients are termed as hyperemesis in pregnancy. So what exactly entails hyperemesis, why it happens, what can you do about it, and what are the treatments available? So in short, hyperemesis is basically due to the pregnancy hormones, beta-HCG hormone, progesterone and estrogen, that are there in very high levels in your body. Some people have, a genetic predisposition for hyperemesis. For example, my mother also had hyperemesis, my sister had, my maternal aunt or paternal aunt had hyperemesis. So of course, I'll be more prone to hyperemesis. Other people, mostly it can also be, a symptom of an underlying condition such as molar pregnancy. So of course you have to visit your gynecologist to confirm that first of all your pregnancy is going at, in the correct direction. Your scan is normal, the baby has a good heartbeat, and there are no otherwise any complications in pregnancy as such. So if all of those are ruled out and you're just suffering from a lot of nausea and vomiting, and every single day after every meal if you're vomiting, then that definitely it is called as hyperemesis. So a normal amount of nausea that happens in pregnancy will last for a few hours in the day maximum, and it will usually subside by afternoon or evening time. Especially if you are in the habit of fasting for a prolonged period of time, that nausea might happen more. If you are not, then it will mostly trouble you during the morning hours. So if that is the case, then it is a perfectly normal amount of nausea of pregnancy. We do have simple medications to alleviate that nausea. So that will take care of that. But in spite of these simple medications, if you're constantly vomiting after every meal, if you're not able to digest food or water, then that is termed as hyperemesis. So more often than not, hyperemesis is also genetically predisposed. So if you have any family history, do let your doctor know beforehand, so that we can, start you on those medications early. And there are some dietary modifications that need to be done by patients who have a little bit more amount of nausea than normal population, and also hyperemetic people. So what are these common things that you can do to, combat hyperemesis? First of all, do not stay hungry for a very long time. And early in the morning when you get up, do not have empty stomach tea, coffee or milk. So if you have all of these three things, tea, coffee or milk, on an empty stomach, the acid in your stomach is going to curdle all that milk, and it's going to produce more indigestion, more nausea, more vomiting. So plain and simple, when you get up in the morning, immediately don't rush to brush your teeth. Sit for some time. Don't make any sudden movements. If you want to drink water before you brush your teeth, that's also fine. After you brush your teeth, make sure you are eating something dry, like a dry toast or probably a salty cracker or a biscuit. So after you eat that, again wait for half an hour. Again wait for the acid to get absorbed by that dry snack, and later on, then after that you can have any seasonal fruit that is available. So eating fruits early in the morning will give you a boost of energy, a little bit of fructose sugar, so at the same time it will fill up your stomach with a little bit of fiber, so there the digestion process can start very easily. If you eat very heavy things like a puri or a paratha or any of these heavy Indian breakfasts, that might not sit well in your stomach. So make sure that you are not eating extremely heavy things during the breakfast time. So after you eat your fruit, maybe you can have your traditional breakfast, whatever you are used to, in smaller quantities, and then maybe have a cup of tea or coffee or milk, whatever you're used to. So throughout the day, make sure that you are eating or snacking every 2 hours so that your stomach doesn't, stay empty for a long time for the acid to start producing again. Along with that, do follow the timings of the medications as prescribed by your gynecologist or your doctor very, very strictly. So the time that your medication is, supposed to be taken, it's very important. If it is before meal, it has to be taken before meal on an empty stomach. If it is after meal, then the tablet, if it is taken before meal, then it can produce acidity, so on and so forth. So it is very important for us to stick to a schedule. And also eating schedule has to be very proper. Avoid any spicy food, any fried food, anything which has a lot of ingredients, or most importantly stale food. So stale food causes a lot of nausea, vomiting, and indigestion problems. Stale food can also cause food poisoning, which is very difficult for us to diagnose in the first trimester, especially if you are having all of these other symptoms. So that is a tad bit about hyperemesis. And if you have any further questions so as to what to avoid, what not to avoid, please feel free to leave them in the comment section down below. We'll be happy to answer. Thank you.